As barriers are broken and new horizons explored, every success story reshapes the future of medicine, inspiring a world filled with possibilities.
The principles of managing patients with pressure injuries, PIs, include reducing or eliminating the cause of skin breakdown and management that promotes healing. Know a patient's risks for developing a PI. Wound assessment tools such as the Bates-Jensen Wound Assessment Tool, BWAT, Bryant and Nix 2016, and the Pressure Ulcer Scale for Healing, PUSH tool can help to determine the individual treatment goals for different PIs. The best environment for wound healing is moist and free of necrotic tissue and infection. When a wound is contaminated with debris, necrotic tissue, or heavy drainage, use a cleaner, e.g., normal saline that is non-cytotoxic to healthy tissue. If the tissue in the wound is devitalized, consult with a patient's healthcare provider to consider debridement, which is the removal of devitalized tissue. The choice of the type of debridement depends on a patient's overall condition, the condition of the wound, and the type of devitalized tissue. Wound, Ostomy, and Continence Nurses Society, WOCN, 2016a. Choose wound dressings based on the characteristics of the wound bed, Bryant and Nix, 2016. The type of dressings needed will change as the pressure injury characteristics change. Frequent wound assessment is key. Categories of wound dressings to use in treating PIs include transparent films, hydrocolloids, hydrogels, foams, calcium alginates, gauze, and antimicrobial dressings. Position patients to redistribute the amount and duration of pressure to prevent ischemic tissue injury. The development of pressure injuries, especially stages 3 and 4 and any unstageable ulcers, in a care setting is a serious reportable event. Clean patients who are incontinent of stool or urine as soon as possible. Use approaches to minimize shear. Lift sheets when repositioning patients. Raise the head of the bed no more than 30 degrees, unless medically contraindicated. Personal protective equipment. Clean gloves. Option: goggles, face shield, cover gown. Sterile gloves. Optional: plastic bag for dressing disposal. Wound measuring device. Sterile cotton-tipped applicators. Check agency policy for use of sterile applicators. Normal saline or cleansing agent, as ordered. Topical agent or solution, as ordered, such as enzyme debriding agent, antibiotic dressing of choice based on patient wound characteristics. Skin barrier, e.g., liquid barrier or stomadhesive hypoallergenic tape, if needed. Irrigation syringe, optional. Scale for assessing wound healing: review patient's electronic health record, EHR, including healthcare provider order, nurse's notes for type of dressing, previous dressing change, and wound assessment, types of topical medications, types of analgesia if needed, and wound care supplies. Assess character of patient's pain and severity on a pain scale of 0 to 10. If patient is in pain, determine if pain medication as needed has been ordered and administer medication before dressing change. Ask patient to describe history of allergies, known types of allergies, and normal allergic reactions. Focus on latex and topical agents. Position patient to allow dressing removal and position plastic bag for dressing disposal. Perform hand hygiene and apply clean gloves. Remove and discard old dressing. Assess wound using wound parameters. Note: this may be done during wound care procedure. Describe body site where wound is located. B stage of wound. Describe extent of tissue destruction. Wound size, length, width, and depth of wound are measured per agency protocol. Use disposable measuring guide for length and width. Use cotton-tipped applicator to assess depth presence of undermining, sinus tracts, or tunnels. Use sterile cotton-tipped applicator to measure depth, undermining, or sinus tracts. Condition of wound bed. Describe type and percentage of tissue in wound bed. Volume of exudate. Describe amount, characteristics, odor, and color. Condition of peri-wound skin. Examine skin for breaks, dryness, and presence of rash.